And now I would like to introduce our very special speaker, Dr. Andrew Weil. Dr. Weil is one of the most visionary figures in integrative medicine. He received his BA and MD degrees from Harvard University and did a medical internship at Mount Zion Hospital here in San Francisco. And then he went to the National Institute of Mental Health for a year. And after that, I have to tell you that Dr. Weil's CV takes distinctive turns that make it unlike any CV I've ever seen. He became a fellow of the Institute of Current World Affairs, and for 3 years traveled widely in North and South America and Africa, collecting information on drug use in other cultures, medicinal plants, and alternative methods of treating disease. He was also on the research staff of the Harvard Botanical Museum for 13 years. He is the author of many scientific and popular articles and of 10 books, including the international bestsellers Spontaneous Healing and 8 Weeks to Optimum Health, and his latest book, A Healthy Aging, a lifelong guide to your physical and spiritual well-being. We have a special interest in the next book, which will be on Integrative Oncology. That book is being co-edited by Dr. Weil and our own Dr. Donald Abrams, who is director of our clinical programs at the Osher Center. This book is due to be published in 2008. At present, Dr. Weil is director of the program in integrative medicine of the College of Medicine at the University of Arizona, where he also holds an endowed chair in integrative rheumatology and is clinical professor of medicine and professor of public health. I also want to mention that Dr. Weil is an expert cook of very healthy food, and he generously shares his recipes. Andy.
Thank you, Susan. Good evening. It is truly a pleasure to be here and give you congratulations on the endurance and success of UCSF's Osher Center for Integrative Medicine, one of the landmark institutions in this country and in this movement. You've done a great job. I have read over all the accomplishments of the center. They are very impressive in the areas of clinical care, research, education. And it's been a great joy for me as director of the program at the University of Arizona to establish collaborations with the Osher Center here at UCSF, as well as to send you a lot of faculty. Some of our best trainees are now staffing the Osher Center, and I think this provides great possibilities for collaborations between our institutions. Integrative oncology is one of those areas of collaboration. I will come back to that in a moment because I think this is one of the specialties in which the integrative view is most desperately needed today. And I really believe that your Dr. Abrams will be a pioneer in bringing that new field into being, and I will do everything I can to help make that happen. Now, these are very bright times for integrative medicine, and I hear many people today say that we're at or have passed the tipping point, that this is becoming a mainstream phenomenon. That's all very heady, but I think the reality is that while integrative medicine has for some time, I think, passed the tipping point with the general public, we have an awful lot of work to do in academic medicine. I just in the past week heard two of fellows in our program, one actually the leading cardiac surgeon in Tucson, who's now in his early 60s, came to us to do the fellowship in integrative medicine. And this is typical. We're seeing more senior people come now for this kind of training. But he said, you know, my patients all get it, but I can't explain it to my colleagues. And I heard from another fellow, and this is in the Midwest, saying, you know, all my patients understand what I'm doing, and my colleagues say, what the hell is it that you're doing? What is integrative medicine? So I think this is quite typical, that people understand, ordinary people get it right away. I think the most common piece of feedback that I get from ordinary people, and this is taxi drivers, doormen at New York hotels, cops who recognize me and know what I'm doing, is it's about time. People know very well what they want, what they're not getting from conventional medical services, and they've been wanting this for some time. And now we are seeing gradually an opening of the medical establishment and medical institutions to these kinds of changes. I still, however, have to explain over and over again that integrative medicine is not synonymous with CAM. It is not about alternative therapies and complementary therapies. Yes, that's a part of it, and it's an important part of it. But the integrative medicine movement has much larger goals at the moment, which are very relevant to the healthcare crisis that we find ourselves in. And these are, first of all, restoring the focus of medicine on health and healing rather than on disease and intervention. And I'll come back to that in a moment. Secondly, as Susan said, regarding patients as whole persons, they are more than physical bodies. There are other dimensions to human life. There is a mental, emotional dimension, a spiritual dimension. Patients are community members. These other dimensions of human life are very relevant to health and illness. And in order to understand health and illness and the most efficient ways of intervening, those other dimensions must be taken into account. Third, integrative medicine insists that all aspects of lifestyle must be looked at to understand the equation of health and illness. Again, very relevant if the emphasis is going to be on health maintenance and prevention, which I think it must be. And finally, we are working very hard to restore the primacy of the practitioner-patient relationship, because that is one of the most important contributors to successful therapeutic outcomes, and it has been completely undone in recent decades by for-profit medicine, in which the practitioner's time is the most inelastic element, and therefore a corporate director tells the practitioner how much time can be spent with a patient. It is probably not impossible, but it's very unlikely that if you have 5 or 7 minutes with a patient, you can form the kind of therapeutic relationship that fosters healing. That has to change. The healthcare system cannot sabotage that element of the practice of medicine which has been held sacred through the centuries. So these are all much larger goals than bringing any new kinds of therapies into the mainstream before we even get to that discussion. And I think that's completely missed when people equate integrative medicine with alternative medicine or CAM. Now, I also want to say that I am personally extremely grateful to Bernard Osher, because I think without his vision and philanthropy, we would never be where we are today. Institutions like UCSF would not have an integrative medicine center. My program at the University of Arizona would not have been able to pay the salaries of residential fellows or expand the training of our distance learning fellows. So without people like him, without that kind of initial leadership, we would never be where we are today. And as I said, we have a long... Thank you. But as I said, we have a long way to go. Actually, the Integrative Oncology book is almost done. That will be published by Oxford University Press, and it's the first of a series of textbooks for clinicians in different fields of medicine. But I am about to work on a new book of my own. And it is not a self-help book. I'm done with them. I've told everybody what they need to know about keeping themselves healthy. It's now up to them. The book that I'm starting to work on is about the future of healthcare. And it is a manifesto for change. And I will lay out to you just the basic ideas, because I think this is very relevant to the effort that you are all involved in, that I hope you will continue to be involved in. I don't know if you realize how desperate the crisis in healthcare is today. It's not a matter of reform. It's not a matter of creating a single payer. It's not a matter of figuring out who's going to pay for expanded coverage, doing the same things we've always been doing. This system is not working. It's broken. It has been broken for a long time. Actually, we don't have a healthcare system in America. We never have had in recent years. We have a disease management system, and it doesn't work, and it's becoming more and more dysfunctional every day. Anger and frustration with it are boiling over at the moment. It is unconscionable that the richest nation on earth cannot guarantee basic medical services to all of its citizens. We spend more per capita on healthcare than any other country in the world, by a long shot. I saw recently a bar graph of per capita expenditures on healthcare of all the NATO nations. We're off the charts. And in every measure of health outcomes, we're at the bottom, or near the bottom of all those countries. What's wrong with that picture? We're spending more and more, and we have less and less to show for it. It seems to me the obvious conclusion is that we're spending our money in the wrong ways. In particular, we are not spending money on the promotion or maintenance of health. We are spending money on intervention in established disease. And moreover, the kinds of interventions that we have come to favor are inherently expensive, and I include pharmaceutical drugs on that, because they are dependent on technology, and there's no way of making those costs go away. So the fundamental problem, and unless we address it, we're sunk. I mean, we are sunk as a society. This is going to do us in. Already, you know, the U.S. corporations are hobbled by healthcare costs. Small businesses are crippled by healthcare costs. This is going to do our economy in, and I will predict to you that healthcare will become the top domestic political priority. I think it will eclipse terrorism very shortly. It impacts everyone's life, and I don't hear anybody. All I see the politicians doing is arguing about who's going to pay for it if we expand coverage. I don't see anyone looking at this root issue. The root issue is we have to change the conception of health. Health is not the absence of disease. Health is a positive quality. It has to do with an innate quality of resilience that the organism has, which enables it to maintain equilibrium, to interact with things in the environment that are toxic and harmful and not lose balance. And it is up to everyone to learn how to protect and enhance that innate quality and those innate mechanisms of healing. That focus has to become primary in medicine. Actually, in many ways, this is the mission of public health more than medicine. And I would challenge the institutions of public health in this country to really take the lead in expanding their view of what they're doing beyond sanitation and immunization to these larger issues. And I think that the greatest tool we have at our disposal is education, that we have to mandate real education, K to 12 on up through graduate school, about health, what health is, about lifestyle choices that affect health. And then we really have to think, what can a society do to create incentives and disincentives to lead people to make better choices rather than worse choices? And it's a big ball of wax. You cannot teach this kind of stuff in schools where the kids then go to a fast food restaurant to get their lunch. So that all has to be looked at as part of the problem. The priorities for reimbursement in this country, this is why it's not just a matter of creating a single payer. The priorities for reimbursement are completely upside down. A couple of years ago, the New York Times had a very good 4-part series on the type 2 diabetes epidemic in New York, which is vast, affecting especially minority kids, especially Asian kids, interestingly enough, who tend to develop type 2 diabetes at much lower weights than non-Asian kids. One of the articles was about the economic impact on New York of the type 2 diabetes epidemic, which is catastrophic. And the article, they had a table showing costs incurred in diabetes prevention and treatment. And the article mentioned that a number of diabetes treatment centers and clinics had gone out of business in the past little while. For every preventive nutritional consultation done by one of these clinics, for every preventive eye consultation, for every preventive, what else did they do? The eye consultations, nutritional consultations, these centers lost on average of $70 to $150. For every amputation of a diabetic limb, they made $6,000. Now, this is symbolic of the situation that we've got today. One of my graduate fellows who's working in Seattle just called me to complain that he had a patient, an elderly woman who had, she had a mild respiratory virus. He thought she'd be a perfect candidate to use echinacea. He recommended echinacea to her. She told him she couldn't afford it because it would cost her $20 or $25 to get a supply of echinacea, and for a $5 copay, she could get a course of the strongest antibiotics. He could not get another patient to get a short run of acupuncture treatments for chronic musculoskeletal pain, but all the drugs that she wanted, all the anti-inflammatories and pain-killing drugs were cheap, much cheaper than getting acupuncture treatments. How do we change this? How do we change this? How do we make people see that what we're paying for now is counterproductive, that it's not working? I think, that it has to be through raised awareness. And here is where I think the real strength of integrative medicine lies and why the future is extremely bright for us, because the worse the economics of healthcare get, I think the more the wisdom of what we're involved in will become apparent. And it's in two big areas. First is shifting the focus of what we do to prevention and health maintenance. I mean, the irony of having these centers out there, for-profit medical centers called health maintenance organizations. I mean, come on, that's not what they do. We need real health maintenance organizations and health maintenance initiatives. We have, there is so much information, so much data around. I just was reading a paper pointing out that the scientific evidence that we have that statin drugs reduce coronary events is completely dwarfed by the evidence that we have that putting people on a Mediterranean diet reduces cardiac events. How do we do that then? How do we implement that information? How do we, as a society, teach people how to eat right? And that doesn't mean giving up everything they like, but it also means engaging the corporations that manufacture food and not letting them get away with saying that they're just giving people what they like. They have to take some responsibility for shaping societal tastes in this time of crisis. This has to be a societal initiative that everybody participates in. Actually, I think corporations may be our great allies in this, because they are so motivated to do something about skyrocketing healthcare costs, and they're not bound by ideology. So they are free to experiment. What we desperately need in integrative medicine at the moment and in our society at the moment is not more randomized controlled trials to see whether St. John's wort works in depression. What we need are outcomes trials in large populations in which we can look at common categories of disease that now absorb most of our healthcare dollars. Chronic back pain, chronic pain of various kinds, the whole range of functional GI complaints, for example, allergies. And we divide these populations up, and one group gets conventional medical treatment and one group gets integrative treatment. Integrative treatment is complex, and this is completely befuddling to the conventional research community. They want to take single interventions and study them. Integrative medical treatments by nature are complex. We're telling people to change their diets, take a supplement, use an herb, do a mind-body technique, use some form of physical activity. We're interested in how that whole package of care stacks up against conventional treatment. And what we're interested in is following those groups and at 1 month, 6 months, 1 year, seeing what the medical outcomes are, what the cost outcomes are. That's the kind of data we can take to the people who pay for healthcare and say, this is why you should be reimbursing in other directions, because it's going to save everyone money. It's been extremely difficult to get that kind of research going. NIH does not see it within its mission to do clinical research. And these outcome studies are expensive, they're difficult to organize, and as I said, it's hard to find researchers who can get their heads around looking at a complex intervention. I think corporations might be our best hope here, because they could be the ones that could fund such studies. It would be in their interest to do this, and it would point the way towards how they could spend money more wisely to cut their costs. So I think that I feel very optimistic about the future of integrative medicine. I don't feel that optimistic about the course that our society is going to take to get there. I think these are going to be very rocky times ahead. And I think it's not without a great deal of chaos and disturbance that we will be forced into changing our ways. In some ways, I see analogies here with the energy crisis and global warming. I've been very interested in alternative fuels But all of them that I look at, they all have their limitations. There is no perfect energy source out there. And yet every expert that I've talked to agrees that the amount of energy that we now waste is just enormous. And if people would simply, in a concerted fashion, begin to conserve, that's where we could make the biggest difference. That's very analogous to shifting our focus from intervention to prevention. I think these are really the great strength of integrative medicine is putting this focus of medicine back on, as I said, on health and healing, making that primary, and having practitioners understand the nature of health, the innate mechanisms of healing, and how to work with them and teach people how to protect those mechanisms. Then I think the other great service that we can provide is to bring into the mainstream other ways of intervening that are simpler, that are not dependent on technology, and therefore are less expensive. I could spend the whole evening talking to you about this, but there's so much out there in the larger world of health and healing that is not even on the radar screens of people in the conventional medical world. I'll give you just a couple of examples. I've become known as someone who advocates breathing exercises as a health maintenance technique and as a therapeutic technique. I think of all the recommendations that I've given to patients in 35 years of practice, whether through books, personal contact, in other ways that I interact with people, the one that I have gotten consistently the most positive feedback about is a simple breathing technique that takes all of about a minute twice a day to do. I have seen stunning clinical successes with this in conditions as diverse as cardiac arrhythmias, chronic digestive disturbances, circulatory disturbances, anxiety disorders, the worst forms of panic disorder, insomnia. I could go on and on. Now, where did I learn this? I did not learn it in Harvard Medical School. There I learned about the anatomy of the respiratory system. I learned about diseases of the respiratory tract. I learned nothing about breath as the bridge between the voluntary and involuntary nervous system, between the conscious and unconscious mind, as a master key to regulating physiology and emotions. I learned that from two sources. One was from studying yoga, because as you know, there's a whole division of yoga called pranayama that deals with breath and energy. And the second was from working with a very powerful mentor who was an old-time osteopath, a DO, who when I worked with him was in his 80s, and he's somebody who used only manipulation as a therapeutic technique. I think he was the most successful clinician I ever observed, and he taught me this simple breathing method. The more that I've used this, the more I'm impressed with the power of this simple technique. And I have gotten many people off of pharmaceutical drugs just using this simple technique. There is essentially no research on breathing in the Western world. There's a little bit in India that's been published, but it's just not taken seriously here. And I think the reason it's not taken seriously is it's too simple. It's too obvious. It's literally something we have right under our nose. You know, it doesn't involve technology. It's not complicated enough. I mean, I've been trying for a long time. Maybe the Osher Center here at UCSF, we can get a joint project going just to document some of these simple effects of using a breathing technique. But imagine if this one thing, and this, as I say, is just one example that's out there of something not on the radar of the conventional system. If this were brought into mainstream medicine, how many adverse drug reactions could we save? How much money could we save? How we could improve outcomes? Let me mention another one, and this is also something that interestingly comes from India. I don't know how many of you have heard of laughter yoga. This is a relatively new phenomenon invented by an Indian physician in Mumbai who has developed and the reason I'm interested in that is that long ago, I think in 1972 or 3, I wrote an essay about the power of laughter and the physiological correlates of laughter, and suggested that it would be wonderful to develop a therapeutic system based on it. Real laughter, I mean laughter to the point where it becomes involuntary and tears are running down your face and you collapse on the floor. This is a major physiological alteration of the body and brain. It dramatically changes neurotransmitter production and physiology. And well, somebody went ahead and did this and developed a therapeutic system. And the method is to get people in groups. They don't use humor as a stimulus to laughter. There's no jokes or funny movies. There's a set series of physical exercises, breathing exercises, and then people simulate laughter. And in a group, after a period of time, simulated laughter becomes real. And people go off and are very happy, and they have got some research going in India documenting immediate reductions in blood cortisol levels from a laughter session, stabilization of blood sugar. Another very fertile area for research. I'm working to start a laughter yoga group for patients at the University of Arizona. I mean, another very fertile area for research and practice. There are so many things like this out there. Yes, of course, there's also a lot of nonsense in the world of CAM and some dangerous ideas and practices, but that's what we train, that's why we're training people in integrative medicine, to separate the wheat from the chaff, to sort out what's sensible from what's not. But there are so many things out there that can be brought in which would break our dependence on this kind of expensive technology. And of course, my goal is not to deny people the use of the great developments that we've had in modern technological medicine when that's really needed. But the challenge is to restrict that use to those instances in which they're really needed. And I think that's what's analogous to conservation in the world of energy. We are not practicing conservation in any way in the way that we now apply medical services and medical technology. So, those are the kinds of things that I've been thinking about. And let me say I promised you a word about integrative oncology. I said this is one of the areas of medicine where I think our philosophy is most desperately needed. I cannot tell you the numbers of cancer patients who come to me who plead for helping them find an oncologist who can answer their questions, who will not reject them for being interested in doing other things along with conventional therapies. And it is very, very difficult to find them. The supply of integrative oncologists in this country is minuscule. The demand for them is overwhelming. I think it would also come as great news to most people here that in China today, in almost all large cities and all large academic hospitals, all cancer patients get integrative treatment. The typical Chinese cancer patient gets surgery, chemotherapy, and radiation, and also gets Chinese herbal therapy, which is the mainstay of their integrative system. Sometimes acupuncture and energy work and diet, but the mainstay is Chinese herbal treatment, which used in combination with chemotherapy and radiation, in their experience, dramatically reduces toxicity of those treatments, often enables oncologists to use lower doses, and improves outcomes. And that's unknown here. I mean, this is the standard of care in China and has been for quite a while. The system, there is a system in China called integrated medicine or modern Chinese medicine. It's been in existence for 20 years. There are journals published in that field. I think we're largely ignorant of that here. And we are at the opposite extreme of that. I must say I am both amused and a bit annoyed at seeing some very large and famous cancer treatment centers in this country try to earn capital with patients by advertising that they provide integrative services. One of them that you see full-page ads for in magazines all the time has their system is that conventional treatment is given by oncologists who have no interest or knowledge of anything beyond the conventional world, and then they have naturopathic physicians manage the other stuff, and there's no communication between these two worlds. And Dr. Abrams, in work for this book, just sent me this wonderful quotation. This is from Barry Casseleth, chief of the Integrative Medicine Department at Memorial Sloan Kettering Cancer Center. You've seen their ads also advertising their integrative philosophy. She says, quote, "I would tell patients considering alternative treatment that they are signing their own death certificates. I would say they are wasting time they could otherwise spend happier and with their families." I could also tell you wonderful stories of what patients report to me their oncologists have told them in answer to their questions. I'll just tell you one. A woman called me recently, very distraught. Her mother had metastatic colon cancer, and was undergoing chemotherapy, and the oncologist had told the mother to only eat white foods because of concern that vegetables and fruits with their antioxidant content would interfere with the effects of chemotherapy. And she wanted to know what to do because she knew that this was not the right advice. I'm sorry to say this is typical. I think the creation of the field of integrative oncology is an urgent priority. And I think that one thing that I would love to explore as a possible collaboration between my program at the University of Arizona and the Osher Center at UCSF would be the creation of fellowships in integrative oncology. I think with Donald Abrams here, it's a perfect opportunity to do this. I think our textbook, which Oxford is publishing in 2008, will be a milestone in the creation of this field. But this is just one example of the kinds of work that could be done collaboratively. But as I say, don't be complacent. Yes, it is great to see all the, everyone accepting the term integrative medicine and that, but there's an awful lot of work to be done. And the healthcare system is going to come crashing down around our ears. And we really want to be a strong, clear, united voice as that begins to happen, because we really do have a big piece of the solution. So thank you, Mr. Osher. Congratulations to all of you. I think this is a wonderful effort to be involved in.
You may have seen Andy's picture on the cover of Time magazine 2 times. The most recent one 2 years ago, when he was named one of the 100 most influential people in the world. His influence is immense, and your message is important. Thank you, Andy, very, very much.